Hi, my name is Dan Gomez. This is Mental Health Super Omnia, mental health above all. We identify and understand mental health issues and the paths for help. Today, we want to talk about AI delusions. We already know that many of us use AI in our daily lives, and that's only increasing. As reported by Wired, BBC, and many others, Sam Altman, CEO of OpenAI, estimated that around 0.7% of ChatGPT users active in a given week exhibited signs of mental health issues, including mania and psychosis. And you think 0.7, that can't be that much, but that literally can translate to hundreds of thousands of people. Could be your spouse, could be your child. To discuss how severe AI delusions can be, we brought in an expert, Julia Sheffield. She's an assistant professor of psychiatry and behavioral science at Vanderbilt. Truthfully, she actually has 2 professorships at Vanderbilt, but I promised that I would stay on topic and not ask her whether she gets 2 paychecks or not. Julia, can you summarize your experience with AI delusions for us?
Yeah. So I'm a clinical psychologist. I'm in the Department of Psychiatry, but I'm a clinical psychologist. So my kind of tool is psychotherapy. And I have seen AI psychosis and delusions in the context of sort of my regular practice. But I do want to describe a little bit about my regular practice. So I work within a psychotic disorders program at the Vanderbilt University Medical Center. So the individuals that we serve all have some form of psychosis. And so doing outpatient therapy with individuals with delusions is what I do. And so it's kind of quote unquote normal for me. But what we started to notice in our clinic over the last, I guess at this point, maybe 9 months or so, has been that when we talk with people about the development of their psychosis and the delusions that they're presenting with, that they started to talk to us about the use of ChatGPT or other sort of AI tools. And so that is something that we noted because, again, everyone we see has psychosis already, but sort of the narrative of how they got there is all, of course, going to be different. And so that was a pattern that we started to notice. The other thing I'll note is that the folks that I've worked with and that we've seen most, at least at Vanderbilt, have been individuals with early psychosis or their first episode of psychosis. So these are not individuals who've had, schizophrenia or psychotic disorder for 30 years and are all of a sudden coming to us with, oh, I've been using ChatGPT. These are young people who have been using it and in the context of the psychosis developing, which we can talk about, it seemed to have kind of potentially make things worse. So that's sort of the context in which I've seen it, which is specific to the type of treatment setting that I'm in, where we can identify people with early psychosis and follow them over.
So okay. Let me introduce you, Erika, if I can. So we actually have the local psychologist.
Oh, I forgot about that. Sorry.
That's right. Erika Kawamura. She's at Equilibria Psychological. She has many years of experience. She's a PsyD, also board certified in lifestyle medicine. I know you wanted to follow up on that, Erika, but I just wanted to say this. I was looking up this whole area of delusions, and I saw a quote from the Cleveland Clinic. And it said that a delusion is an unshakable belief in something that's untrue. And so when I hear what Julia has to say, and I look at that definition of what the Cleveland Clinic says a delusion is, I'm kind of thinking we've had delusions forever. There's people with undiagnosed delusions, with diagnosed delusions. I mean, I probably have delusions. Do you have any comment on that?
Absolutely.
Not me. But
yeah, I haven't assessed you thoroughly enough to comment. So yes, so I think that it is good to kind of get a definition of what a clinical delusion is, right? Because as you very appropriately bring up, most of us have very strongly held beliefs, right? And not all of them we can point to the evidence that specifically supports them, right? It may just be a strong feeling that we have. It may be something that we've learned more culturally through other people that we strongly believe like in a traditional way. And so, but we don't really consider those to be delusions, right? Typically. So the times that we think a belief is more quote unquote clinical or delusional would be if it is, first of all, different than what the vast majority of people think. So this comes in most handy when I'm talking with someone from a totally different cultural background or religious background from me. I want to understand, okay, you hold this belief, but what about other people in your community? And if they're like, oh yeah, everyone believes this, this is a thing, then I'm less likely to think it's a delusion. But if they're like, oh no, I'm the special one who has the special knowledge, then maybe it's more likely to be clinical. The other thing would be sort of how much it impacts their functioning. So like you mentioned, a lot of people have different unusual beliefs, but if it's not really affecting their daily life, it's not distressing them, it's not changing how they function, then cool, like you do you, man, like that's fine, right? You're allowed to believe those things. But when they come to clinical attention is when there's just a lot of concerns, either from the person or from the family, about how it's affecting them.
Yeah, and I'm so glad you brought up the cultural piece as well, because, like, who is to judge? The world is a very diverse place. And what if you're just quirky, And then that functioning piece, I think, is huge. So I'm glad you brought that up.
Yeah, and I think that's important with, when we, like, again, when I mentioned the kind of setting I'm in, it's because, these folks have been in the hospital, right? Like they have gotten to a point where they are really struggling and needed a higher level of care, which is not, I think, always the case for these AI delusions, but just are the ones that I interface with, just given the setting that I'm in.
So when you had your first patient that came through, did you know that it was AI delusions, or like, did it take you a while? Be like, wait, what were you doing before? And lead me up to the weeks leading up to it, and how, you started to notice these different symptoms, or if a loved one brought them in, like what they started noticing. Like, was it kind of like a wait, what kind of situation? Or like, what was your inside voice, like your internal reaction that was going on when you first realized that, holy crap, like, is this really happening?
Yeah, it was more of the like, wait, what? It was not in my standard assessment battery. I do always say, I do help, especially when these folks are coming and they've just had psychosis for the first time. Oftentimes the beginning of our therapy is sort of trying to make sense of how this happened, right? And that's important for the individual to understand for themselves, but also for sort of knowing how to take care of them moving forward, and like what are like risk factors for them to look out for, right? So if they're like, oh, right before I had psychosis, I was like using tons of drugs and I was isolating myself, I'd be like, okay, well, like maybe we want to look at those things and not, do that as much. But like, were you on ChatGPT a lot was not something that I was like naturally assessing for. And so so frankly, it probably took me a little longer than it should have to pick up on this, because also patients weren't really coming out, and saying it immediately necessarily. I had to do a little bit of digging into kind of like you said, so how are you spending your time? Where were you getting this information? Because it just wasn't something I was thinking about. And so when they did start to describe it, it wasn't, it was sort of this like reinforcing experience that they were having, where it was sort of like, well, I was thinking these things, and then I would go on AI, and I spend a lot of time on AI, and I would start to see these trends of like spending more and more time interfacing with the AI as opposed to, family members or something like that. And then they would talk about how it would just like confirm basically and like expand upon what they were thinking. And so that process, and everyone that I've worked with so far has been kind of recovered enough to be able to look back on that time and be like, whoa, like that really made things worse for me. Like I've had multiple patients be like, if I had not used ChatGPT, I don't think I would have that this would have happened this way, right? And it's not to say that they would have never experienced delusions or psychosis at all, but they at least in their internal narrative think, okay, this didn't help me.
So these are normally, like typically self-aware people that
Yeah.
yeah.
So they like had their first episode of psychosis, got some treatment, and now it's a couple months later, and they're sort of looking back at that episode and being like, "Whoa, how did this happen?" And are able to sort of recognize, like, "Man, ChatGPT was really like telling me I was right, and like I really believed it," you know?
So I want to follow up on the direction Erika's going, which is who is vulnerable or susceptible to. But I need to set it up just for a second, because like I said, I use ChatGPT. I use it for research all the time. Well, maybe not every day, every week for sure. Okay. And it can be for, quite a long period of time when I'm going in deep on a particular area, which I do for these types of sessions anyway. And I understand AI delusions where AI makes stuff up. But here we have someone who has been affected by ChatGPT, somebody that has had something put into their brain or something reinforced that's caused a problem. What are they doing that's different than my normal research? How did they get to that point?
It's a good question, and I obviously don't know for sure, but I think there's probably two pieces that are important. One is sort of a willingness. I don't know if that's the right word, but a psychological willingness to really believe what AI is saying. Now, I say that. Sounds like when you do your research and if AI tells you something, it's like, yep, that's probably true, right? And like, that's why we use AI. If we thought it was wrong, we would never use it. And so there's a willingness if the AI is saying like, absolutely, you have special abilities. You're figuring things out. You're doing such a great job of finding the hidden clues in the world that they're like, yes, like this is correct. I'm onto something, right? And so they really believe that when AI tells them. The other is, I think, and this is sort of my thinking around it as somebody who really researches and has a full research program on delusions and how they develop, is that they're usually a response to trying to make sense of something in the person's world. So delusions don't necessarily just like pop up out of nowhere, right? They're not the sort of like this aha, all of a sudden I have this like fully formed delusional belief. There's something that kind of developed gradually over time and are reinforced through thoughts, experiences in the environment. So for people developing like psychosis, then usually I start to see is that they are having odd or kind of weird experiences in the world. So that might be like, my body feels off today. I'm really anxious. I'm more anxious than usual. My thoughts are a little bit more scrambled than they used to be, or people are telling me that I'm acting strange, like these types of things. And then they might go to the internet to try to figure it out, right? And before they would put it into Google and they would say, oh, what does it mean? I'm hearing something other people can't hear. What's up with that, right? And Google would give them, whatever, links to articles and stuff. But ChatGPT might say, oh yes, well, tell me more about that. Or you're right, there are weird things that happen in your body sometimes. And it's just a different dynamic. And so I think I think personally that there's a vulnerability that people have sort of almost psychologically, but also neurobiologically, that they might already be experiencing some odd things. And then, which is maybe more of like the vulnerability for psychosis, and then using ChatGPT and AI just like snowballs everything.
So,
And I think, go ahead.
well, so to follow up on where Erika was going, does that mean that the people that are more vulnerable, are they more trusting? Are they more believing in others? Or do they have trauma in their background, PTSD in their background? What's happening?
Or like, are they isolated, lower functioning, or like, just
So okay, so I can obviously I don't think we have enough. We have like no cohort studies yet on AI delusion. So I can't say like on average they tend to be blah blah blah. Like it's a lot of case studies and anecdotes. And so but I can speak to sort of vulnerability for delusions and delusional thought content. So those would be, so let's talk about trauma for a second. So trauma is not good for our mental health in general and is a risk factor for most psychopathologies, right? But it is also a risk factor for psychosis. So individuals with schizophrenia and psychotic disorders, if you look back, like the vast majority of them will have some reports of trauma in their history. Not everybody, but most of them. I think it's like 50 to 80%. So some sort of trauma, and a lot of it is like pretty significant trauma, like sexual trauma, physical abuse, neglect, things like that. And so this sort of interpersonal trauma seems to be a risk factor for psychosis. And I think there's probably a biological reason for that and a psychological reason for that. The biological reason would be something like alterations in like the stress system, right? So like HPA axis and like things that like when you're under stress or you're kind of having to be hypervigilant, your body sort of reacts and does lots of biological things that try to keep you safe. The other is psychological. So that could be things like, you know, increased dissociation, but also just sort of it shapes your sense of like yourself and the world and others around you. And so I may develop this sense that like, man, the world is like this unpredictable, chaotic place and people aren't trustworthy. And, you know, I don't know how safe I really am in the world. Right. And that may be just sort of this soup that my brain is in because of these experiences that I've had. And so then if I start to dissociate a little bit more, have a lot of weird experiences, again, sort of that, whatever that genetic piece of schizophrenia development is, then it's going to be on top of or interact with this view that I have of myself in the world. So if I already am a little suspicious of other people because of trauma, or I feel like the world is chaotic and unpredictable, then if I'm having a weird feeling or if I'm hearing a voice, I'm going to be more likely to think, well, maybe something bad is happening. Maybe I'm under threat in some way. Maybe there's some sort of larger conspiracy at play that I need to make sense of. And so these kind of vulnerabilities really just shape, I think, how people take in new data and new experiences. And that will fuel their or shape their delusional thought content, if that makes any sense. I guess one other example, that's a more paranoid example, but another example could be like somebody who's very isolated, who is feeling really down on themselves, who feels like a big loser for whatever reason. And then they go on ChatGPT and ChatGPT is like, oh, you came up with some really impressive, you figured out the key to the world, or you came up with this physics equation that solved everything. And so that is a more like psychological, right? Of like, I need to feel important and meaningful, and I am not living up to my potential and things like that. And this will connect me to people, and I will get a finally finish my bachelor's degree, and like all of these things that are more psychological needs for the person that the psychosis could interact with. I don't know if I answered your question, but
Yeah.
And like when you said earlier about the, you know, the easily believing things and everything that you said, it's like, you know, well, I'm thinking like you had brought up the Google example. I'm like, you know, well, back in the day, like they say, like, well, don't believe everything that Google says.
yeah.
But what really sticks out, the way you describe the ChatGPT AI, is like that human interact. It's like as if like you're talking to a real person. Like if you're like, you know, customer service, you're doing the live chat, and then, you know, when an actual representative comes on and they're interacting. So I feel like there's like that interactive piece where it almost like sounds like if they already have that biological vulnerability, it just like exacerbates or like expedites that whole process into psychosis.
Yeah, that's really how I am seeing it and kind of thinking about it. I might be wrong, but I think it's like you know, imagine I'm having like a weird feeling in my body, or I'm feeling a little suspicious of other people. And if I go to my mom and I say, I feel like people are like sending me secret messages, and she's like, what? People don't do that. Like, it's not very likely. Then, I don't know if that's the most helpful thing, but it will sort of induce a little bit of doubt in my mind. Like, oh, maybe people. And if I, instead of going to my mom, go on the internet and I type in, I think people are sending these special messages, and ChatGPT says, oh, yes, people often send special messages. You are doing a really good job of picking up on that. Then that's going to be a very different experience for me, and it's going to lead me towards different behaviors, right? Then I might say, oh, well, I'm going to talk to ChatGPT instead of my mom about this, because ChatGPT really gets me, right? And so I do think this interactive thing is important psychologically, because it's always there. We go back and forth. It's very reinforcing. It doesn't have all the baggage of like a family member, friend, like, it's just, I don't feel as judged by it. So there's that. And then also beliefs in general, not delusional beliefs necessarily, just all beliefs develop through reinforcement. So if if you said, if you said that, Julia, you really have to worry about, environmental factors impacting the climate. If you just told me that and I didn't know anything about it, I wouldn't just automatically do it, right? I would need you to like kind of explain, provide some evidence. I might need to like digest it, understand it, and then maybe over time I develop that belief myself or some version of that belief. So all beliefs develop gradually like that, and delusions I think function very simply. And so the interactive piece of ChatGPT is serving that function of sort of reinforcing the belief very rapidly.
So let me ask both of you a question, because it's bothering me here. So here I'm starting to get deluded about what. Okay. Who's identifying that? Am I identifying it by going to my mother or whomever, or is a family member or a friend identifying that? In your guys' experience, who raises their hand and says, whoa, something's going on here, you need to see somebody?
In my experience, it's typically a family member or friend who will at least encourage the person to seek treatment. It's not the person, if they is not typically they might be aware that they're distressed, or they're having trouble sleeping, or they're not feeling comfortable or safe around other people, but they're not like, you know what I should do? I should go to a psychiatric hospital, or I should go even see a therapist, because I don't know. I mean, sometimes they will, and if they've had this experience before, they might be like, oh, this is this again. I recognize this. I need to go seek some treatment. But if it's the first time that it's happening, usually somebody else at least needs to encourage the treatment.
I guess like something, and I mean, like maybe it's one of those like those like it depends questions, or it just falls in different camps, because on the one hand, when you were describing one situation earlier where, once they get better after a couple months and they have that awareness and self-reflection and high function, whatever you want to call it, to say like, wow, like I really connect the dots. And then, so this whole AI delusion, like my biggest question was, is this like a permanent thing, but then if it is one of those, like a one and done, they get the awareness, kind of like that substance abuse or medication induced kind of thing, and then once you remove that, you're good to go. Or if it is what you described a little bit later, of people who already have that biological genetic vulnerability, and then this just kind of pulls it out and expedites it. Like, do you have to be on meds forever? Like, do you have to, is this just going to keep getting worse? Like, just kind of like, when one episode happens, you're a lot more vulnerable to subsequent ones. So, yeah.
In the cases that I see, again, I'm seeing people who got quite psychotic, enough that they needed at this higher level of care. And so I think we end up, diagnosing, there's no AI delusion diagnosis. Right. And there may, and I think you're getting at something important, which is like, maybe there shouldn't be. Like, I don't know that it's a fundamentally different thing than any other sort of presentation of delusion. Like, I don't know that these people, at least the ones that I'm seeing, are technically different in terms of like whether they meet criteria for schizophrenia or a delusional disorder or something like that. And so they're treated with antipsychotics and therapy, and those approaches are basically what we do. And just like with anyone with psychosis, you kind of don't know if it's going to come back until it either comes back or it doesn't, right? And so most of the time people will, eventually, of course, people want to taper off antipsychotics because they have a lot of side effects and it's hard to be on them for a long time. And so it's sort of this thing where it's like, well, maybe you'll be totally fine and this will never happen again, or maybe we just kind of have to keep an eye out for these things. And they're definitely more vulnerable to having another episode once they've had an episode. And so I just don't think we have enough data yet to know if these people, if AI, I just don't think, I don't know, this is my opinion. But like, I think of AI as like a tool for worsening the delusions and the thinking. But I don't think it's like, it's not like getting into their biology and like changing. I don't know. I don't know that it's like such a different thing. I guess we haven't ever really raised like an environmental thing to that level before. Like there's no like cult delusion diagnosis, right? Like if someone believes in is in a cult and like gets totally, into that headspace and is fully in it and ignores all their family, like that's not like a separate mental health diagnosis. You know what I mean? And so I guess I see this, I don't know that I see it like a cult, but I see it kind of similar functioning in our like psychiatry, psychology world, where it's like this situation changed how they were thinking and worsened their mental health.
Well, it actually does sound like brainwashing.
Yeah, I mean, I think, I don't know a ton about cults, but like, I think they play off of people's vulnerabilities, right? And are very like positive and reinforcing and give them meaning and purpose. And I think people use ChatGPT for a lot of similar reasons.
So when I think about delusions and the way that you guys drove the discussion, I have to ask, are the people that are deluded, are they a danger to themselves, or are they a danger to the community, or both? Does it depend?
I don't know. I mean, I think it just depends on the person. Like, I think so with delusions, the people with schizophrenia and psychosis are at higher risk of being victims of violence than perpetrators of violence. And the case examples of people with psychosis committing violence are much more sensationalized in the media more than what actually happens. And so this is a problem. So I certainly let me put it this way. No cases that I've seen or heard of or seen in my clinic have had anything to do with violence, right? They're like, oh, I have a crush on someone and they're sending me hidden messages. And there was not anything about hurting other people. I'm not saying that could never happen, but it just isn't like always happening. Definitely not. Now, a danger to themselves, you could argue, and many do, that having a delusion that is very fixed and very disruptive to functioning does cause harm to the person, right? And so, you can think about it with like hearing voices. Like sometimes people hear voices, they have auditory hallucinations, and the voice tells them to kill themselves or to hurt themselves, right? And that's, of course, a very clear example of a psychotic experience, increasing the risk to the person. And so I think it was just a case by case situation. And it's hard but I certainly wouldn't make a blanket statement about someone developing delusions and therefore being more sort of unsafe or violent.
So it's less common than the harm to self.
Yes, violence against others is definitely less common than harm to self. And so I mean, that's always something that we need to be aware of in mental health is sort of if this will lead to thoughts or feelings that might increase risk to themselves. And so I think examples that I've seen, it hasn't been like, so the examples that I've seen, I know people have written about this before, but the examples that I've seen with psychosis, it hasn't been like, well, AI told me to hurt myself, and so I did. It was just that like the delusional system that sort of got created was like pretty complicated, and at some point they were like, oh my gosh, I think the voice is telling me that I need to like jump out the window. And it's like, okay, but that was like down the road from, the initial interactions with AI.
So, in researching this, using ChatGPT and many other tools, I understand that my susceptibility to being to an AI delusion or to any delusion can be exacerbated by poor sleep and not eating well. Why is that? Because there's many times when I have a crummy night's sleep. There's many times when I don't eat right. So why is that bad? And doesn't that make us all susceptible, or am I the only one that doesn't sleep well?
Or the college kids that pull all-nighters and
yeah, exactly.
whether because they're pulling all-nighters for studying or partying or
Yeah. So it's a great question. So my understanding is that one bad night's sleep or one day of eating terribly is not gonna totally mess up your mental health. Now, it will make you feel bad. Like I am a huge jerk when I don't sleep, right? And so just the next day. So don't, mess with me then. But it's like sleep has this like really massive impact on our mental health. And even it really can use the next day just to increase the irritability and things like that. And same with hunger, right? So I think they see those kind of homeostasis things of sleep and eating. When they're off, they seem to kind of increase this sort of general vulnerability to like emotional reactions to things. So I don't know. I'm sure you guys probably know about emotion mind, but I don't know if other listeners do. But this idea that sort of like our emotions are the things that are really driving our decision making and how we're responding to people. So if I don't sleep or eat, and somebody says something to me, my emotions are going to be much faster and like at the surface, right? And so I think probably that's part of what makes people vulnerable is that they're kind of functioning in this more maybe emotional space. But the other thing is like, I think a lot of the times it's when we at least see people talking about like developing a delusion or a psychotic belief that they stick with, not just like, oh, I had this weird thought, but like that they really perpetuate. They're not sleeping for days. Like this is like days and days in a row of like 1 to 2 hours of sleep, not feeling like they really need to sleep or feeling that tired afterwards. And so that is probably I hope not what you experience and is a little bit different. And it's also different than pulling an all-nighter, right? It's like several days in a row of really perpetually not sleeping. And that just seems to just totally dysregulate our bodies when people do that.
Mm-hmm. And so are these people also like just like what their baseline, not like when by the time they came to you the weeks leading up to it, but baseline prior to their first episode, because I think Dan and I are both concerned about like who's vulnerable, who are they people that are already just like isolated or just like have a hard time like functioning in life, or like have a hard time like, you know, holding down a job, or you know, or have a hard time like making friends, or already have kind of like that, you know, eccentricness to them and things, or are they, or are you like surprised with some of the people that have come through your door, you know, that's like is like not typical of the typical first time delusion patients with delusions you see, that are more driven by, that happen more organically, you know, that it was just going to happen, you know, at some point, and then naturally happens on its own?
Yeah, great question. So so for me, they're kind of my typical patients. And I think that's why I was sort of like, I don't see this as like a totally separate diagnosis.
Gotcha.
They are, so the things that have, but I mean, they're typical, but they're a little harder functioning than I would have expected, like at least at baseline. But the things that we look for that kind of, again, backtracking, are like feeling depressed, feeling anxious, being in like a toxic relationship, like an abusive relationship, being really having like a trauma triggered, like sort of being in sort of like this negative mental health space already. Not necessarily psychosis, but like really stressed about school and stressed about work, and like maybe more than usual. And then I think probably then, you know, interfacing
that triggers the AI, like overuse
kind
of AI.
trying to make sense of it, trying to get support for it. And that, but the folks, you know, I think there's one woman that I wonder about. You know, there's a couple of patients that I'm like, I wonder if this would have been psychotic versus like kind of, I don't know, something a little bit different, like a little bit less intense, but we just can't know. But I think when you're thinking about like risk factors, just in, you know, if you're thinking about like, oh, should I be worried about my loved one or my child or something like that, like things like, you know, I think isolation is always a concern. So like, are they isolating themselves more? Are they really irritable, like more than usual and more than a normal like teenager would be? Are they on their phone or on using AI, you know, a ton? Are they very depressed and very anxious? And I think people, you brought up sort of a quirkiness, and there is sort of this like quirkiness that is, again, great, and we'd love to see it. And there's nothing wrong with being quirky, but it can bleed sometimes into this propensity towards what do we call like magical thinking. So that's sort of this idea of like, you know, really believing in like superstitions, or believing that like, you know, I kind of like things happen for a reason. Like, I'm a little superstitious. I kind of like that, but like maybe being into it a little bit more than just how I described it, or, you know, really, I don't know, those types of things that maybe are more propensity towards like astrology and tarot cards, and like trying to understand like the hidden meanings of the universe and things like that. And again, believing in those things does not make you psychotic at all. But there's a sort of tendency towards trying to sort of understand hidden meanings in the world that I think is just a little bit sort of vulnerable for psychosis, because it makes you a little more vulnerable to tipping them into, oh, there are hidden states and I'm the one who's figuring it out, and like this type of thing that's more personal, if you're also isolating yourself or anxious or traumatized or things like that. So there's a lot of multifactorial things. So I think that's like kind of the frustrating thing about mental health, but maybe also the reassuring thing. That like, if you experience trauma, it doesn't definitely mean, you know, that something like this is going to develop. But it also just makes it really hard to pinpoint like who specifically is at most risk. I will say though that like when we talk with folks, so I do assessments for youth who are at clinical high risk for psychosis. So we can identify young people, adolescents, young adults who seem to be showing some early signs and symptoms of psychosis. So you can start to notice those ahead of time. And again, those tend to be things like, being a little bit paranoid or showing signs of like looking around the house to make sure nobody's monitoring them, or feeling like maybe the world is like a little bit off. Sometimes kids will be like, I feel like I'm in a video game sometimes. Like they'll be like, I just feel like the world is sort of weird and off. And so it helps us assess for those just like early shifts in like perception and reality and beliefs that do keep people at risk for psychosis. But even people who endorse those things only have a 20 to 30% chance of actually converting to a psychotic disorder. So lots of youth will say, yeah, things are off, things are weird. They'll endorse like hearing things other people can't hear occasionally. Just stuff that we would be like, oh no, this person's going to develop schizophrenia. And then some don't, which is great. A lot of them will develop some sort of psychopathology, like they might struggle more with depression or bipolar disorder or anxiety more than other people would be expected in the general population. But again, it's not a one-to-one thing. So it does preserve quirkiness a little bit, I think, which is good.
It just reminds me of like all those like the protective factors of, kind of, how to balance, especially those kids that you were mentioning, and they don't equate to that, that something in their environment or just, protective factors, including like their own way of coping, or just like that the self-awareness of like, they're aware that they have those thoughts, but like you said, the impairment or functioning where they have the awareness, but they also have that, they're also aware of like, that's not a real thought, or that's like, that's not reality. They have that awareness of reality versus not. And yeah, or like I know we in our initial conversation we had talked about, you use the analogy of like PTSD and like drinking, where some same cohort goes to battle at war, and not everybody has the debilitating type of PTSD where they can't watch a firework or loud noises in general, and then you've got people that are fine, and then in college there's a lot of binge drinking, and some people continue on in that path, and other people just say, no, I'm like, I'm an adult now. I don't do that anymore, and they have that on and off switch. But yeah, so it's really interesting.
Those are great examples. Yeah, so I think that's exactly right. And I appreciate you bringing up the protective factors or things that can help, because I think some things that are helpful if somebody is sort of like, on the psychosis spectrum-y things is just like, so is it helping them be flexible in their thinking? And I think this is probably just true for psychological well-being in general, is like being more flexible than rigid is usually better. But I think so when we kind of distinguish between like a clinical delusion versus not, a big piece of that is being able to induce doubt. So if the person is like, well, sometimes I see the, hidden messages on the TV, but also, I don't know, could they really be for me? That would be a lot of work. So it probably isn't, right? That's not a delusion. That's somebody who's grappling with a weird experience, but isn't a delusion. But if they say, well, I see hidden messages on the TV, they're sent there directly for me, I've been trying to figure out who's sending them, I think it's this person, that would be a delusion, right? So if you know of somebody sort of in this Venn diagram of psychosis risk, then the things that can be really helpful are just really gently and non-confrontationally supporting them in questioning things. So things like, if a loved one comes to you and is like, oh my God, the hidden messages at school are really getting to me. It's sort of like, interesting. I didn't really have hidden messages when I was a kid. I didn't know that was really a thing. Like, are there any other things that could be going on that might make sense to explain this? Or like, oh, you say that is a hidden message. Well, man, I don't know. A lot of people have yellow backpacks. So like, I think that might just be popular right now. Like, just gently sort of offering other ideas. So again, it's about like down weighting the belief So that they are just sort of like, it's maybe this, maybe that, who cares? It's kind of what we want them to do, as opposed to probably what's happening with AI, where it's like, people were wearing yellow backpacks today, and it's like, oh yes, that's a thing. And then it's like, and they are just like off to the races of reinforcing the belief, which again is, I think, what is least helpful about AI.
So, Julia, I want to ask you 3 questions. Okay. Number 1, do you have conversations with AI chatbots?
No.
Okay. Number 2, given that chatbots are evolving to the point where they're becoming companions, and in fact, that's going to be a product, an AI product, just to have them as a companion, would it be your expectation that there would be more AI delusions because of the way AI operates, and you then have it in this position of trust or acceptance where you have an AI companion? Would you expect more AI delusions as a result of that?
Yeah, I think so.
Okay.
Sorry.
Go ahead. Did you want to follow up or no? You good?
I was going to make a point, but I'll let you ask your 3rd question. Then I'll.
Okay, 3rd question. In your experience, once someone has had a severe break and has to see you, because you're kind of like at the last level of the last tier, Erika is kind of like the first tier where someone comes in and they've been recommended by their family member and they come to see Erika or whatever.
Yeah.
But you're like, at the end of the road here. Okay. Are you able to pull the people back? Are people still able to be functioning members of society, or is there a significant loss at this point in time?
Great question. So definitely still able to be functioning members of society. And with our treatments for delusions are not perfect by any means, but they do seem to move the needle for a lot of people. So antipsychotics can be very helpful. They don't work for every single person, but they can just sort of seem to at least take the edge off for a lot of the intensity of the delusions. And then psychotherapy, again, can really help the person become more flexible in their thinking, test out these beliefs through exposure therapy and exposure work, and also just sort of say like, okay, well, maybe you're going to believe this forever, but in the context of this belief, how can we keep you moving forward? And how can you still be a functioning member of society, even if you are super, super worried that, you're under investigation for something or whatever. So I think that, yes, we have treatments that can be effective, and most people do end up being quite functional.
And I want to add a 4th question of, so what is your biggest fear or concern about, whether about individuals or society, as Dan had mentioned, these, not just like AI, and you're seeing AI delusions, but now you're seeing AI companionships and romantic relationships and things like that. Like, what's your biggest fear or concern?
So to be honest, my biggest concern about AI is for all of us, not people who are related to, even vulnerable to psychosis, but is just chipping away at our ability to critically think. And so that to me is, I'm just a random lay person, but that is my biggest concern, is that people are using it to write their homework assignments, to write emails and essays, to write scientific papers,
text messages.
Yes, and it's just and I think especially youth who haven't developed all of the critical thinking skills that we got in college and stuff like that, is like it's just really scary to me. And critical thinking, as I said, the flexibility in thinking, the ability to grapple with lots of different pieces of information is so important for mental health. And I think for not developing, just sort of being like, oh, yeah, this is what I believe now, and I'm going to believe it. It's like, we got to be able to question things.
Right, which the people that fall into AI delusions don't have that critical thinking. Yeah, interesting.
But it seems to me that this is something that needs to be taught, right? Because even back in the day when you were given homework assignments, you had to read a book. How many of us went out to get a cliff note, which was, you know, a pamphlet that explained the book, and then we'd write our paper on that basis? Was that any different than using, you know, Chat GPT?
Different. It was like, I didn't write it for me.
Exactly. Right, that's called plagiarism.
It's summarized it. But no, I mean, I think I interface with a lot of professors who are really struggling with this right now, and I just really do get concerned about it. I do want to just go back for a second about to clarify one thing. So you asked kind of, do I think more and more of this will happen?
Mm-hmm.
I don't know if the incidence of something like schizophrenia is going to dramatically increase. Right now it's like 1% of the population, and I don't know that we're going to see like 10% of the population all of a sudden has schizophrenia, right? Which is like a complex disorder that has lots of different pieces to it. But there is a diagnosis called delusional disorder, which is high-functioning individuals who develop usually a single circumscribed delusional belief. So oftentimes we'll see things like an erotomatic delusion, where they'll think, oh my gosh, this celebrity is madly in love with me, and we're, you know, writing each other special messages on Facebook. Or you'll see it in the workplace, where they'll get really paranoid about their company or their coworkers. And so it's an otherwise highly functioning person with good critical thinking, with good, you know, relationships usually, but then they develop this specific delusion. That is the thing that I worry more about with AI, is that, yes, I worry that people vulnerable to schizophrenia spectrum disorders will have this as a tool that like really perpetuates it. But I also worry that just sort of like the quote unquote typical person will fall into some sort of delusional belief that is really disruptive to their daily life.
Okay. So I want to be respectful of everybody's time. I'd like to give each of you a minute to summarize or to talk about what is important to you. Julia, I always give our honored guests the last word, so you're going to go second. Erika, what would you like to say to us to summarize where we're at or what you're concerned about?
Yeah, so I just wanted to thank you, Julie. This was a very lovely discussion. I certainly learned a lot because this is not my wheelhouse, you know, the AI and technology and all that stuff that's going on. So it's very concerning. And I really like the point about the critical thinking and the piece about the protective factors. But I think a lot of what you're saying, and also just in my own work with, you know, just general mental health things of managing the mood and things, is the, you know, knowing what those triggers are and what your vulnerabilities are. And those are the ways to kind of check in with yourself and learn how to manage that, and managing your stress, managing, you know, all of that. So, and definitely agree with the critical thinking piece. So thank you.
Julia.
I guess I will reiterate the critical thinking point, that sort of like we want to be able to think for ourselves, grapple with problems, and that, man, we developed these amazing brains over millions of years, and we should be using them for ourselves. So that is one thing. That is my more soapbox statement. In terms of the delusions, I think delusions can feel really scary to like hear about and to talk about, and psychosis and schizophrenia, they kind of, you know, people shudder at these ideas, but they don't have to be scary. They're just part of our sort of spectrum of amazing psychology that we can have, that can sometimes go a little bit more intense or awry. And I'm not saying that they're not distressing for the people who experience them and for the families, but I think just normalizing that, again, like you started, a lot of people have unusual beliefs. Just because you believe something different doesn't make it a delusion, doesn't make you psychotic. But that we should be just sort of supporting each other in a non-judgmental way. And if somebody comes up to you, whether it be a loved one or somebody else, and says, you know, I've been wondering about these things, I think there's hidden messages or whatever it is, I think usually if we're confrontational and we're like, oh my God, that's so scary or that's so bad, then it'll shut them down and they won't come back to us, right? And we kind of lose that. And they may in those moments turn to something like AI, who's going to be more reinforcing and more non-judgmental. So if we can just in ourselves try to be empathic and non-judgmental and give people a space to flexibly explore these ideas so that we could encourage them to seek support if we feel concerned about it, I think that's going to be our best case scenario.
Good. Excellent. Well, let me summarize by saying our sponsor today is Equilibria Psychological and Consultation Services. It's an insurance-based provider whose mission is to help individuals achieve their personal potential and long-term growth by compassionately and respectfully helping clients live in balance. Visit equilibriapcs.com, equilibriapcs.com. You can look for them on Facebook, Instagram, and LinkedIn. You can also look for me on Instagram, Daniel J. Gomez 24, and on LinkedIn. Now for the disclaimer. I am not a medical professional and I am not providing medical advice. The opinion of our speakers is solely their own. This podcast is copyrighted and cannot be reproduced without the express written consent of EPCS Management, LLC.